Hey everyone, I'm your host, Jared Taylor. We have two great guests today. Joining me are two members of the leadership team of both Koda Health and Privia Health. I'll let them both give their intros. We'll start off, Dr. Fernandez, if you want to start off giving your background, and then we'll kick it over to Dr. Mohan and go from there.
Yeah, sure. Keith Fernandez, Chief Clinical Officer of Privia. Been with Privia about 6.5 years now, and have had dual roles there, a national role as Chief Clinical Officer, and also I entered Privia with one of the markets in Houston, Texas, and ran and continue to manage the ACO in that market and the value-based care. Past history as physician in chief at Memorial Hermann and the Physician Network Quality and Safety Program, and one of the early Medicare shared savings programs.
Wonderful. And I'm excited to be on this webinar with you, Keith. I'm Desh Mohan. I am one of the co-founders and Chief Medical Officer at Koda Health. So I'm an internal medicine physician by training, practiced for several years as a hospitalist, and then about 4 or 5 years ago, got recruited into a biodesign innovation fellowship, and we spun out Koda Health, where we focus on streamlining and making advanced care planning really easy for health systems, particularly for their Medicare patient population.
Thank you both for the backgrounds. We'll dive into kind of each will have a chance to kind of go back and forth here. We'll start with you, Desh, to kick off with this question. We'll kind of alternate. I want to go through how each of your organizations approach innovating in healthcare, and then really kind of what initiatives you're focusing on the most to kind of move innovation forward within each of your organizations.
Yeah, absolutely. So I think one thing that's really helpful, just as contextualization of how our work came about at Koda, is how we started. And that started off very much in an innovation ecosystem. So I'm also based in Houston, Texas, and we started off in the Texas Medical Center Innovation Institute, where they essentially bring in individuals and tell them to go into the major hospital systems like Memorial Hermann, like Houston Methodist, MD Anderson, look at pain points within the system. And I think that's really how innovation in healthcare should be approached. It's really going down and understanding the root cause of problems and identifying how you can actually address that in a really tangible way. And so when we started off, one of the big things that we saw that was really a pain point was that there was a lot of care being delivered to patients in the inpatient setting, the ICU settings, that often was misaligned with values and what they believed. And one of the big issues that we saw is there was very few conversations happening proactively for these patients. And our goal was, how do we make it easier for health systems like Privia or others to have those conversations in an easier way, where patients can define what values are important to them, what care is important to them, who they want to make decisions for them, so that if and when they face serious illness, they actually get the care that they want. And I think that's a way that we approach innovation is, let's go down and look at the root problem, and let's actually do a lot of discovery and needs finding with patients. And I think that's a core tenet of how innovation in healthcare should be approached. And that's generally how we approach things in an ongoing basis at Koda. So that's our kind of big picture approach to innovation and how we kind of progress as an organization.
Yeah, so I'll just tack on there from Privia's standpoint. I joined Privia from a big health system that had employed doctors, an academic medical center, and then a lot of private practice doctors. And I think, we did great things at Memorial Hermann, but I always wished I could do it with those private practice doctors that are not necessarily a part of another system. Still a very large number of physicians doing that. And the problem to address is, how do you take private practice physicians and put them in an organization that actually gives them all of the power of a big health system, gives them more revenue, more financial backing, innovation, technology, and actually make a success successful program with those kinds of physicians. So the opportunity to join a big practice with a single tax ID, with a single technology platform across the country that allows just huge power in looking at different populations and is scalable. So I don't need people everywhere to do the job. And then to bring this technology to the service of the doctor, making it the doctor's life a little bit easier. And I just will say that the innovation there, I think, is many different pieces, but the real innovation is all of the pieces together and bringing that to private practice physicians who otherwise just couldn't do that.
And thank you both for your comments on this. I want to make sure too. So we're going to go back to you, Dr. Fernandez, and then you'll both have a chance to speak to it. Medicare is such a crucial part of the healthcare landscape, right, in the U.S. I want both of you to kind of talk me through how your organizations are engaging in supporting Medicare patients today.
I think Medicare, first of all, obviously very critical, to success in healthcare. Critical because that's where the money is spent in healthcare. I mean, the massive amount of money. And thirdly, they're the sickest people in the country. Who do you want to deal with if you're a doctor? You want to take care of people who are sick, and you want to try and prevent them from getting sick. So the Medicare population is very, very important to us. I think we're really lucky because Medicare is where innovation happens too, right? They're looking at new ways of engaging both patients and practices in taking better care of patients at a lower cost. So they've begun these programs around Medicare shared savings programs, Medicare Advantage, REACH program, direct contracting, just lots of trying different stuff. Much of it fails. That's the truth. And that's okay. That's innovation, right? Trying to change things and it not working. So those programs allow us, I think, to really put forward an effort that can result in a financial return. And that financial return is really not to enrich, everybody in the system, but it's to be able to do better, different things to provide a more concierge type of experience to Medicare patients. Instead of having them pay a fee, they actually have it built into a program to take better care. Because as we've shown, I think now pretty conclusively, taking really great care of people, providing a concierge type service to people results in better outcomes, and that's lower cost.
Yeah, absolutely. And to kind of add to that, I absolutely agree. And I think Medicare, in a sense, leads the way for a lot of the rest of healthcare. I think CMS essentially defining that, every Medicare patient has to be they want them to be a part of an accountable relationship by 2030. That sets a standard for the industry that we're moving towards value-based care as an industry, and I think that's really defined a lot of innovation outside of that initial realm of how can we really help deliver quality care at a lower cost. And that's essentially how we think about it as well as an organization. We primarily focus on the Medicare population. Obviously, we're focused on delivering advanced care planning and care for serious illness. And that's largely focused in the Medicare space. So we're working with organizations that are part of ACOs or MSSP ACOs, Medicare Advantage plans, direct contracting groups, part of the ACO REACH program. And so a lot of where we are able to innovate is because of the innovation that Medicare drives themselves. And so I think they've really led the way for the industry. And I think a big part of the value-based industry's innovation within that is because of their success.
We'll stay with you, Desh, for this next question. When you're innovating in this space, are there any key, as it relates to Koda Health, are there any key collaborations, partnerships that you have today? And then we'll kick it over for Privia Health's point of view as well, that are helping with that innovation?
Yeah, well, I think a couple of partnerships that I think are particularly, important to highlight. One is because of, I think, the standard that CMS has placed on, moving towards value-based care, I think a lot of organizations are beginning to recognize the importance of bringing in tool sets and capabilities into their organization that they didn't once have. And so one partnership to highlight, I think, the recognition that organizations see is we recently partnered with Cigna Medicare, where they're rolling out Koda's advanced care planning tools to their entire MA population. And I think this is something that you might not have seen 5-10 years ago, because there was a really different landscape that existed there. But now with really the focus that we have in the ecosystem, there is a real importance on really highlighting better care for our Medicare population, for serious illness, for social determinants of health. And with a lot of the changes that we're seeing, I think we're seeing interest from our partners in that aspect. So that's one that I think is particularly interesting on our end. The other that I think is really important is we have a partnership with Care Journey, where one of the aspects that we're really trying to improve is our ability to identify patients who really need advanced care planning and how to establish better benchmarks for serious illness care. And I think the aspect and understanding of data across the healthcare ecosystem is one that's really important for us to be able to drive innovation forward, not in silos, but as a entire industry, if you will. So those are two that are particularly valuable and interesting on our end, I think.
So I will say we're constantly dealing with people who are trying to innovate and to make some important points. I think we have several partners in areas. Maybe the most obvious one is Athena. We have a single platform with Athena's help, and we interact with Athena continuously about how can we do things better for the physicians. We like almost everything we do to be integrated into that platform so that the doctor doesn't have to go in and out of those sorts of things. And in particular, this is just generally true with all of these innovative things happening. The real problem is not great ideas. We've got a lot of them. The real problem is executing on great ideas. And that's very complicated. The relationship you have with Cigna, boy, does that take a burden, off of us, like having to come up financially with a deal for a program like this. Actually, the payer saying, hey, we're going to back this up right out of the gate. That's very useful. What I'd like to see, Desh, is for you to be that for all the payers, so that when we see a patient in our practices, we know what's going to happen. We know that they're going to have access to this program. We can then become really powerful in that getting that done, executing, because when the practice says, hey, I want you to do this, and Cigna says, we offer it, and the practice says, that's what I want you to do, those patients are going to end up doing it. And it's really critically important that they do. I think I've been doing this for many, many years. And the greatest things you can do in healthcare are taking care of people who have advanced illnesses. You want to prevent them first. So I don't want to, take that away. But the truth is we're not doing too good in preventing. A lot of different forces causing that. But once a patient is sick, you want to be sure that they're going to have those things that they want, that they're going to understand the consequences of not making these decisions now, some of the real very negative consequences of that, and to do it with a trusted partner. So I think with the physician, the primary care physician actually referring into an advanced illness program, an advanced care planning program, the benefits there are just huge. We've looked across this with our patient population, and it makes a gigantic difference in the outcome. That outcome, may in fact be a serious, death, right? And it may just be a much happier death, which is what we hope. It also, though, I have to say, is not associated with sooner death, right? I think most people have shown that this actually prolongs life when the patient feels like they're in control of things. They do things that they want to do, and they have more power. And it turns out they live a bit longer as well. So The kind of stuff that Desh is doing is very, very important to our patients and, of course, to our program.
Yeah. And not to mention also the caregivers and loved ones of that patient who are often patients of usually the same providers, same groups. And so kind of added benefit there, not just for that patient, but for family members and loved ones as well.
Yeah, I think, in fact, I'll just say this. I'm a gastroenterologist, and for a lot of my career, I was asked to put feeding tubes in. I was unusual because I didn't put most of them in. I'd talk to the patient, I'd talk to the family, and say, here's the pros and cons of that. And about 60% of the time, the patient and family would say, we don't want that. Engaging the family in these discussions is absolutely essential because, otherwise there's too much second guessing. And so I think a real complete program does that. It addresses, obviously, the patient's wishes and delivers an understanding among the family members about what might happen, what might not happen, and what that actual patient wants. So very, very important.
We'll stay on you for this next question too, and then we'll kick it back. So this is the advice portion, right? What advice would you give to these other organizations, right? Both of your organizations are innovating in this space. You're trying to, without giving a roadmap to your competition of here's what you should be doing, right? But just broadly, in terms of innovating in the Medicare space, what advice would you give to organizations out there?
Yeah, it is so tough. I think it seems like it should be easy, because I think there are so many good ideas, and generally, you're not in the business that I've been in for a long time, or Desh is in, where you're not good at selling your product. It's something that you really have to be positive about, and a lot of times you hear a lot of positivity when there are clearly not everything is positive. It never is, right? But great salesmen can really both accelerate the growth of a company and of course accelerate unhappiness with the company. So I think what I look for are people who I develop a personal relationship with, if they've worked with other people, who I've actually talked to the other people about and how has it gone, who have successful relationship. That's great, but it's not always true. I think people who have partnered with Privia early on might have said, well, you don't have any successful relationships yet. It takes a while to build them. And then you have to be committed to the partnership. So I'm saying I'm putting a lot of pressure on the innovator, but I think on the person receiving that innovation, you've got to say, I'm going to commit to making this successful. For us, the most important thing there, right, is that the physicians and the practices, I'm going to say more than just the doctor in the practice, but the whole practice is also committed to this being the right thing to do by patients. You go try and sell somebody on, you can make $72 on this. I think you'll likely not sell it for very long. If you go say, this is going to make that patient better, right, then you'll be able to sell it. So anyway, execution is critical. That takes both partners in a relationship to work together.
Yeah, I agree. And I think what Keith's highlighting is understanding your stakeholders really well is, I think, critical. And particularly on the partnerships end, finding those early partners who are as excited about what you're doing as you are, because it really requires that initial partner who is willing to take risks and willing to really be as invested as you are in the success of this. So having someone who thinks about the need as you do is, I think, critical. But I think in a broader sense, thinking about innovation in Medicare, one thing that I think is very different from other aspects of healthcare innovation is you have to really understand the Medicare patient population. Innovating for a 65 and older population is very different from delivering a device or a product to someone who's 30 years old. And doing that due diligence and spending that time talking to patients, to understanding their needs and understanding what really needs to be developed and designed for them. It takes a lot of time, but that you're developing something that will actually be useful to them, and not something that is going to have extremely low engagement rate that's not going to be picked up and not going to be used, because at the end of the day, if your innovation's not used by your Medicare population that you're developing or designing for, it's pointless. So I think taking that upfront time to really do the legwork and understanding, particularly that patient journey, is critical.
Well said, both of you. Last question for each of you. We'll keep the format that we've been doing, so we'll roll with you, Desh, for this next question. So this will be as we wrap up. What's your vision for the future of each of your organizations, specifically towards how you'll continue to help the Medicare population?
Yeah, so I think a vision for me that I think I'm excited about is care becoming more and more patient-centered. I think CMS and Medicare in general have placed more of an emphasis on patient experience. And I think that's really valuable, particularly for the work that we're doing. One of the things that I have the advantage and a privilege of is really hearing patient stories and patient journeys. And having that experience of hearing about, a COPD patient who now is struggling to cook because she's now on oxygen, but she also has heart failure. And so she's just eating TV dinners and now is struggling with her heart failure getting worse and going into the hospital because of that. Understanding that patient journey and innovating and developing solutions that are really focused on understanding the needs and developing solutions for them, I think is really important. And I'm glad that there's more and more of a focus on patient experience and a more patient-centered care. And I think that's only going to improve our care delivery mechanisms as we understand each individual patient better in our care delivery. So that's what I'm excited about and my vision for the future.
Yeah, Desh, I think, let's see, what big company has, provides great service and has lasted a long time where the people don't like the service? I mean, it's like, it should have been primary from the beginning. I'm glad it's becoming primary too. So I have a couple things I will just say. I think we're going to, at Privia, continue to innovate with the whole practice. I think these private practice doctors don't just take care of Medicare patients. They don't take care of one slice of life. They're taking care of big populations where everybody comes in. They like it that way, right? It's not everybody needs to do that, but they like it that way. So we have to be sure that we do that. Integrating advanced care planning, advanced illness management, actually, I think benefits the whole package. These people then have parents and they grow up and they are parents and they learn that in a certain system, you get a certain type of care that is, to the point, like I said, concierge type care. It is better care and it doesn't cost anymore. In fact, it probably costs the whole system less. So I think that's important. I do want to say it's important for us to be successful. All right. And for that means patients have to do better. I can't sell to a doctor a technology and this, that, or the other without making the case that this is going to help a patient actually do better. That's what they really want. They're willing to do a lot of stuff. I'd like to make it easy. So patients, better outcomes, right? Taking some of the burden off practices, physicians and nurse practitioners, and the rest of that practice that is helping that. And then for people like me and Desh, we have to grow, right? We're not going to change healthcare if we have one slice of a small segment of Houston. And we have to win. It's our job to make sure we're delivering on that promise. Because again, if we're not winning, we're not going to be providing the benefit to the patient. It just won't work. And we won't in our business for the physicians and their practices.
Well said, both of you. Well, I want to thank you both once again for joining me on the Titans of Healthcare podcast. Excited to continue the conversation with both of you and continue innovating and doing great things for the Medicare population and beyond.